So, your daily commute might be shaping your health more than the food choices that you make or the exercise that you miss out on. So, this is something that I learned the oh so hard way on my daily commute. One time I was coming home from work and I was tired, I was exhausted like many people, and I was sitting on a bus and someone right in front of me was coughing. But at that time, I was just like, I'm tired. I really don't feel like moving. I didn't bring my mask today and I'm gonna be good. Well, unfortunately, I was not good. And a couple of days later, for the first time, was COVID-19 positive. And this was about 10 days before my friend's wedding. Needless to say, I did not make the wedding. I was very upset. But I say all this to say that so many of us live daily lives where we're exposed to different health conditions and health concerns and all these different things, pollutants that really do impact our health more than the quote unquote choices that we make. So that's why I wanted to have this conversation today. Thank you to those who are jumping on here live, to those watching the recording. You can always drop it below. I just want to introduce you to this is the part 4 of our 5-part series that we've been doing on the impact of our neighborhoods and built environments on our health. And the reason I wanted to talk about transportation, specifically public transportation and commuting, is because even though, yes, someone like me has a car and arguably I don't have to necessarily use public transportation, it is something that I do utilize. But I also know a number of people who don't have any choice, right? Their public transportation is either their only source, maybe they have to take taxis or Ubers or Lyfts, or maybe they have to walk or even bike to where they have to go. So there's different ways in which we are literally exposed to the world and everything that has to come with it, which sometimes means that we could put our health at risk. And that's why I wanted to talk about this one specifically in the context of work, right? Not just commuting for things that you do or don't have to go to, not necessarily commuting for the purposes of entertainment or spending time with family, but things that necessarily have to happen. We have to go to and from work. Many of us, while some of us may work remotely, not all of us work remotely 24/7. I mean, I shouldn't say 24/7. Hopefully nobody works remotely 24/7. But many of us don't work remotely for the entire week, right? We might have some day, we might be on a hybrid schedule. There's a number of people I know that are now being told they have to go back for work who were remote the whole time and now they're going back for 5 days in the office. So whatever you land on, just know that you're welcome to this conversation. I definitely want to hear from you. But for those who are new to me, let me properly introduce myself. My name is Tanisha Campbell. I am the health writer here at EVWH Community. If you hear someone in the background jingling, that is my dog who decided at this moment Penny Dina was hungry and she's going to eat. So she may join us for a little bit. But what I wanted to do was talk about 3 specific ways that our commute can really put our health at risk, just to put it in context. And the first thing that we've touched upon, but I want to dive a little bit further, is talking about public transportation and how that can expose us to infection risk and even air pollution. And I want to ask you this question is like, how long does it take for you to get to work? And how do you get there, right? For me, it normally takes me about 45 to 90 to not 90, 45 to 60 minutes, really on a good day, 90 minutes on a terrible day to get from where I am to like downtown Boston. And I share that because in that time, I'm commuting between the bus and a train. I'm commuting between many different people. Like I'm interacting with really hundreds of people a day, just going in between those spaces. And for so many of us, because we have to take public transportation, or maybe we don't have to take it, but it's the easier route to do. If you live in a city like I do where it's very expensive to park, it might make more sense to take public transit than to go down there. Or maybe you don't have access to parking and public transit is the only way you have to get to places you have to go to. Or maybe you're taking Ubers and Lyfts because that's the most convenient thing, but that can still expose you to risk depending on who's your driver, right? So those are just some things that come to mind when you think about the ways that public transportation in general can put us at risk, right? When we're in spaces with other people who are either ill or who either knowingly ill or unknowingly ill, which goes into my second point, is that another way that really our commute can put our health at risk is obviously for some people there's limited PTO and also lack of work from home options for some people. So what I mean by that is you might have people in careers where they have limited PTO, paid time off, meaning that If they're not working, they're not getting paid. So if you have that limited PTO options, or maybe you're having to save it for special events, you might be having a child or a grandchild or a friend, or even yourself might be getting married, right? So you may be saving up your PTO for that. You might be saving up your PTO because vacations coming up, so like some school breaks coming up, for so people will save up their PTO for that. So if you have those limited options, when you're not feeling well or you're feeling kind of sick, you may not take that time off. And I want to kind of ask you too, thinking through that specific instances, have you had to work when you were sick just because you couldn't afford to miss a day? That is something that I know many people often have to do. And I see them commuting on the bus with me and the train on me. For instance, the person who was coughing and clearly had COVID, was the fact that, and I understand, it was the fact that they likely had to go to work. They literally probably didn't have the paid time off to do it. They didn't have necessarily the financial stability to take a time off. So because of circumstances like that, that can create a situation where people are going in, even though they're ill, even though they're not doing well, and knowing that they're probably going to get sicker, but there may not be that choice, or that, depending on where they work. But that also goes into like lack of work from home options. We know during the pandemic, many people, not everybody, there were still some people who are essential workers who never worked from home and worked the entire time, out in the public. And that was a risk in and of itself. But for some people who do have lack of work from home options, that can also be a challenge, where maybe people say you can work from home, but it's only during certain days. Or some people have, well, you get to work from home on this part of the month, but on this part of the month we want you in the office. So also that also creates that challenge, because once again, you're dealing with exposure, you're dealing with people who may be like me, have autoimmune conditions, so we might be a little bit more susceptible, people with chronic conditions, people with certain illnesses that make them more susceptible to getting sick. Those are something to think about. And then the last thing I wanted to talk about is really when we are not able to take time off of work because it means loss of income, right? And that is something that we've touched upon, but I want to specifically talk about this because I think for so many people who don't experience this, it can almost seem like people are being selfish when they're sick and going to work. Instead of thinking about, why don't we have a better healthcare system? Why don't we have a better work and infrastructure that supports people to be able to take that time off, so they're not putting their health and everyone else's health at risk by going into work, by commuting, by being around people when they really should be home resting. And that's something that I want to kind of think through, is like, how many of us have not missed work, or because we had to miss work, it did put us in a bad financial situation. People who had to make that choice to say, hey, I am just sick as a dog. I'm not going near anybody. I don't even want to be near myself, more or less. And because you took that time off, you didn't get your paycheck. There was no way to get reimbursements. There was no way to get financial support, and you had to struggle, right? That can be really difficult on people. And once again, yes, it contributes to you getting your health getting worse, but it also contributes to you be putting in a financial situation that's going to make your overall situation worse. So I wanted to bring this up because so often when I see different conversations around health, they're so focused on you as the individual and the choices that we make, but sometimes we forget that there's a bigger societal issues that can be in play, that can be impacting our health more than like our own individual choices. And I just kind of want to name that. As we talk more about the environment, a lot of people are asking questions now about how different technologies, emerging technologies, artificial intelligence, and different things are really impacting our environment in the way that things are operating, and which cities and which countries are getting more polluted and which communities are getting more polluted than others, for us to kind of open up this lens to realize, like, these are questions that we should all be asking ourselves and thinking more critically of it. I don't necessarily want to take it to the stance of let's judge everybody based on things, but let's kind of have a little bit more critical of a conversation when we think about the ways that, everything from where we commute to like how we get to and from work, and what challenges that can create for us, and obstacles can that create. And maybe even the harder question sometimes is like, is it worth the paycheck, right? Is risking our health worth that paycheck? Because for some people, the answer is always going to be yes. But then for some of us, it may not be. So that was a lot for me to say, but that's just what I wanted to share with y'all. This was part 4 of our series. Part 5 of our series will be coming out next week. So we'll be finishing off. If you're not yet subscribed, you can always go to the ebwhcommunity.com to subscribe. Thanks so much for watching, and I will see you all in part number 5.